Can myotonic dystrophy lead to sleep apnea? Have you ever wondered how certain genetic conditions can affect sleep? Today, we are looking into whether myotonic dystrophy can lead to sleep apnea. This is an important topic, especially for those with a family history of this condition. Myotonic dystrophy, particularly myotonic dystrophy type 1, is a genetic disorder that causes progressive muscle weakness and wasting. This muscle weakness can impact the muscles that help with breathing and keeping the airway open during sleep. As a result, individuals with myotonic dystrophy are at a higher risk of developing sleep apnea. Sleep apnea is a condition where breathing repeatedly stops and starts during sleep. There are two main types: obstructive sleep apnea and central sleep apnea. Obstructive sleep apnea occurs when the throat muscles relax excessively, blocking the airway. Central sleep apnea happens when the brain fails to send proper signals to the muscles that control breathing. Research shows that nearly all adults with myotonic dystrophy examined had some level of sleep apnea, ranging from mild to severe. Many patients experience excessive daytime sleepiness, which is a strong sign of sleep apnea. However, some may have sleep apnea without noticeable daytime sleepiness. In individuals with myotonic dystrophy, sleep apnea can lead to frequent drops in oxygen levels during sleep. This can worsen respiratory function and increase the risk of respiratory failure. While tests like spirometry and blood oxygen levels can provide some information, they are not reliable enough to screen for sleep apnea alone. Therefore, sleep studies, known as polysomnography, are recommended for those with myotonic dystrophy to diagnose and manage sleep apnea effectively. Family history is another factor to consider. Since myotonic dystrophy is inherited, having a family member with this condition may increase the likelihood of sleep apnea within the family. Recognizing and treating sleep apnea in individuals with myotonic dystrophy is essential for improving quality of life. Treatment options may include positive airway pressure devices and respiratory support. It is important to monitor these individuals closely, as they may have increased sensitivity to anesthesia and respiratory depressants. In summary, myotonic dystrophy can indeed lead to both obstructive and central sleep apnea. This is due to muscle weakness that affects breathing during sleep. Sleep apnea is common among patients with myotonic dystrophy and requires specific diagnostic and treatment approaches to manage effectively.